Mommy break, and I thought we should talk about how to recover from a C-section. I had a lot of comments on my last video about how to take care of your afterbirth stitches down there, and I thought we should talk about how to take care of your stitches from a C-section. So most of the time with a C-section, you have a scar right down here. It's right kind of under your underwear line would be, and it goes horizontally like this. Every once in a while, there's some cases where they have what's called a T incision or horizontal incision, and it goes across like this, but that's a little bit more rare, and usually they try to do the horizontal incision if they can. And then it's usually sewed up with self-dissolvable stitches, but every once in a while, again, sometimes they have to use what's called staples, and with staples, you'll have to go back to the doctor for them to remove the staples. But for both cases, the care is pretty similar for afterbirth. About 24 to 48 hours postpartum, they'll take off the bandage and make sure everything is healing properly. Usually you'll have steri strips on, which are tiny little band-aids along the incision site. It helps to keep it closed. And then that's when you can shower. So when you go into the shower, all the other soap that you're using on the rest of your body, just let it run over the incision. Don't scrub or use any kind of scented products. Just let any water and soap run over, and that's it. That's all you gotta do. Once you get out of the shower, the important part is to make sure you pat dry really, really well, because bacteria thrives where there's moisture, and you don't want an infection post-op. The other thing to mention is if you have what's called a pannus or a little bit of an overhang, you will want to lift and pat dry underneath the overhang. This is so that you, again, don't have any bacteria, and it helps to keep the area nice and dry. Sometimes people find it helpful to put like a towel there. I would say just make sure you dry it really well and then let it be. Less is more for any kind of wound or surgical incision. Another thing that's important for C-section recovery is you will not be able to carry anything heavier than the baby. So this is around 10 pounds. So you can carry the baby, but you can't carry anything heavier. So the baby in the car seat would be too heavy. And this is until your 6 to 8 week postpartum follow-up appointment. Recovering from surgery is really tough, and C-sections are still major abdominal surgery. If you have any questions, always talk to your doctor, and know that you are super strong. C-section mamas are warriors too.